This video will help you understand and prepare for the prostate needle biopsy, or PNB, that has been recommended by your physician. The prostate needle biopsy is one of our most valuable tools as we strive to rule out prostate cancer or to evaluate a cancer thought to be present. In addition to this video, you will have received a PNB planner, which outlines the steps in preparation for the procedure, including those medications which are to be avoided in advance of the PNB. We rely on you as our partner in your healthcare. As you review this information, it is important that you follow the instructions in this planner closely. Starting 7 days prior to your procedure, we ask that you stop all over-the-counter medications which are classified as blood thinners. It is important to discontinue these to prevent any excess bleeding after the procedure. After a prostate needle biopsy, it is normal to see intermittent blood in the urine for 3 days to 2 weeks, in the stool for 3 to 5 days, and in the ejaculate for up to 3 months. If you are taking a prescribed blood-thinning medication such as Coumadin, aspirin, or ibuprofen, the nurse will communicate with your prescribing physician as to when you may stop these medications safely before the PNB can be scheduled. Failure to observe these medication holds could result in the cancellation of your procedure, even if you're already in the clinic. Once the procedure has been scheduled, you will receive a phone call from our automated system reminding you of your appointment. Please consult your planner for a short list of guidelines to follow on the day of your procedure. Please check in 45 minutes prior to your appointment time and remember to bring your insurance card. This check-in is done at the Buck Pavilion lobby on 9th Avenue. Then come directly to the urology department office on the 7th floor, where the nurse will check your weight, blood pressure and pulse, and review your medications and allergies. If you regularly take Coumadin or warfarin, you may need to stop at the lab first. The RN will then give you an antibiotic injection in your hip. Please let us know if you have any allergies, especially to drugs such as Cipro, penicillin, or cephalosporin class antibiotics. We want to make sure we have the correct antibiotics ready for you on your procedure day. Some patients may not be a candidate for injection due to their medical allergy list. These patients will receive an IV antibiotic. The RN will review with you what to expect during the procedure and will answer any questions you may have before you sign your consent form. The RN will then direct you to the lobby for about 10 minutes to allow your body to process the antibiotic prior to the PNB. During this time, you are asked to empty your bladder before the procedure begins. This is for your comfort during the procedure. You will be brought to the PNB procedure room and will change into a gown. You will lie on the table on your left side in a curled position. The urologist will ask you to verify your name and date of birth before the procedure begins. The doctor will usually perform a digital rectal exam and then place a lubricated ultrasound probe into your rectum. The probe diameter is about the same as the gloved finger that your MD uses to check the prostate during the rectal exam. Ultrasound waves will create a graphic picture of the prostate. The doctor will inject the area with a numbing agent called lidocaine. Please let us know if you have had any problems with lidocaine. It is like Novocaine, often used by dentists. It feels like a light sting and works very quickly to make the rest of the procedure more comfortable. The physician will then take a few measurements of the prostate. The MD will then take 8 to 12 biopsies, and this takes about 3 to 4 minutes. Most patients describe the biopsy to be like a dull thump. You will hear a pop sound from the spring-loaded mechanism. The MD will then step out of the room while the nurse remains with you. You will rest on the table for about 5 minutes, then the nurse will assist you as you sit up. Your blood pressure and pulse will be checked, and if you have no dizziness, you're finished and ready to leave. If you are experiencing lightheadedness, however, you'll lie down for another few minutes until you're feeling steady on your feet, at which time you can dress and you'll be discharged. Here's what you'll need to watch for after your PNB procedure. You may see blood in the urine for 3 days to 2 weeks. If you see pink or red urine, it is important for you to increase your fluid intake to dilute the urine to a light pink or yellow color. Plan for light activity for a few days following the PNB. For your comfort, you may want to schedule your appointment for a time when you can have 2 to 3 days with less activity. No yard work, housework, gym workouts, or lifting greater than 10 pounds for 1 week, and no biking or horseback riding for 2 to 3 weeks. When washing lubricant from the rectal area, there may be some spotting of blood. This may also occur after a bowel movement for 3 to 5 days. If you experience heavier bleeding, or if the toilet shows a significant amount of blood after a bowel movement, you must call the office immediately. This is a rare complication, but you do need to notify us without delay. Your semen may also be discolored to pink, red, tan, or brown for 6 weeks to 3 months. This will not cause harm and will resolve on its own. Again, refer to your planner for a list of those symptoms which should prompt you to call the office immediately. They include fever above 100 degrees, chills, sudden onset of weakness, blood in urine, excessive blood in stool, difficulty urinating. Call promptly as you may need additional antibiotics. Drink a gallon of fluids daily to reduce infection risk, flush the bladder, and dilute bleeding. 3 to 5 days are required to generate the final PNB report. If you've not heard from us by day 7, please call your urologist so we may share your results. For the week following your procedure, please plan as follows. Continue to avoid blood-thinning medications for 1 week unless they have been prescribed. In that case, your physician will let you know when it is safe to restart these medications. Please ask your nurse or doctor if you have questions about your medications. Common over-the-counter medications such as aspirin, Aleve, Advil, or Motrin are blood-thinning medications, as are many supplements. So we ask you to avoid these for 1 week before and after the biopsy. The PNB planner you received contains a more complete list of those medications and vitamins to avoid before and after the procedure. Maintain a routine of light physical activity for 2 to 3 days. When your urine color has returned to yellow for 24 hours, you may resume your normal level of activity. Still, no lifting heavier than 10 pounds or strenuous house or yard work for 7 days. No bike, motorcycle, or horseback riding for 2 to 3 weeks. Please alert a member of your care team if you have any additional questions. And thank you for choosing Virginia Mason for your care.